morning, everyone. I'm Dr. Smitha Bhatt, a professor of medicine from Father Muller Medical College in the beautiful city of Mangalore. I'm very grateful to Dr. Narsingh Verma sir and Anuj Maheshwari sir for giving me the opportunity to come to this beautiful city of Lucknow and give a very, very important talk. And the topic here is how to manage hypertension in a lactating mother. Dear friends, as mothers become older when they conceive, we as physicians will see older females who become pregnant and who might very well have many medical comorbidities when they conceive. And hence, therefore, they may have blood pressure even when they're breastfeeding their babies. Now, the tendency is to be careful, and rightly so, about prescribing medicines to mothers who are breastfeeding. But what we should remember is hypertension itself can be extremely dangerous, especially in the first few months after delivery when the mother is extremely prone to a stroke. So hypertension control is very, very crucial as well. Now, how do we go about it? How do we choose which drugs to prescribe? Well, there are certain drugs which you can choose. You can choose calcium channel blockers, beta blockers. Interestingly, ACE inhibitors, which are dangerous in pregnancy, can be prescribed cautiously in women who are lactating. Now, you must remember that there are certain people who are at risk. For example, mothers who are breastfeeding premature babies and the very, very young neonates, for example, we have to be careful in them. Which drugs will you choose? As I mentioned, CCBs, calcium channel blockers, beta blockers, ACE inhibitors. What would you avoid? You'd avoid alpha blockers. You'd avoid angiotensin receptor blockers because there's not much evidence about them. And you would not give diuretics either. And the reason you don't give diuretics, dear friends, is because this decreases the amount of milk produced. If you look at the guidelines, there are various guidelines like LactMed, where it tells you which drugs you can prescribe and how to prescribe them. Unfortunately, there's a fair amount of contradiction even among the so-called regulatory bodies. So a common sense approach to prescribing antihypertensives in lactating women is very good. And let me tell you about that common sense approach. Firstly, you choose larger molecules, molecules which are more protein bound, and molecules which have a poor bioavailability. How would you schedule them? So you try to choose drugs which have an OD dosage and try to give them after the baby is given its last feed at night, just before it goes to sleep. Suppose you're giving a drug with multiple dosages on the other hand, you try to give them, dose the mother immediately after she feeds the baby. Regardless of whatever you prescribe, you must remember to monitor the baby frequently. In case of beta blockers, remember to monitor for bradycardia. In case of ACE inhibitors, look for hypotension, seizures. Calcium channel blockers are relatively safe. I have not told you the most important thing of all. The most important thing is to have a conversation with the mother. Mothers, rightly so, are a little bit worried. They say, doctor is giving me drugs, I'm breastfeeding the baby, is it safe? Tell the mother that hypertension is more dangerous than the drugs. Tell the mother that the alternative medicines that she may choose instead of our allopathic antihypertensives, that may be more dangerous. I'd like to conclude, friends, by remembering mothers, when you're treating a mother, a pregnant lady or a breastfeeding mother, we are privileged not to just have one patient, we have two patients we're taking care of. Be extremely careful and extremely, let's say, focused on the health of both the mother and the baby. Thank you so much for your attention.